Jake. Welcome back to Healthy Living Talks. How's everything today?
Hey Emma, I'm okay, but I've been dealing with acidity a lot lately. That burning sensation after meals, sometimes even at night.
Ah, yes, acid reflux. It's really common and can be uncomfortable if ignored. Today, we'll discuss what causes it, how to manage it, and some lifestyle tips that really work.
Sounds perfect. I've tried a few things, but it keeps coming back.
That's normal. Let's start with the basics. Acidity happens when stomach acid flows back into the esophagus, which doesn't have the same protective lining as the stomach. That's why you feel the burning sensation, bloating, sometimes even nausea.
That explains a lot. So, what usually triggers it?
Several factors: spicy or oily foods, caffeine, carbonated drinks, alcohol, late night heavy meals, lying down immediately after eating, stress, even smoking.
Stress too? I've been having long workdays lately.
Exactly. Stress increases acid production and slows digestion, making reflux more likely.
How can someone tell if it's something serious?
Occasional acidity is normal, but if you experience persistent heartburn for more than 2 weeks, trouble swallowing, unintentional weight loss, vomiting, or chest pain, you need to consult a doctor.
Got it. So, mild acidity can be managed at home. What are the first steps?
Start with your diet. Avoid fried, spicy, or acidic foods. Eat smaller meals more frequently rather than heavy meals. And make sure to eat slowly. Eating too quickly can increase acid reflux.
I usually eat big dinners and go straight to bed. No wonder.
Try to stay upright for at least 2 to 3 hours after meals. Gravity helps keep the acid in your stomach.
Okay, I can do that. What about beverages? I love coffee in the morning.
Caffeine is a common trigger, especially coffee. Try green tea, chamomile tea, or ginger tea. Water is always good. It helps dilute stomach acid. Avoid carbonated drinks in the evening.
How about lemon water in the morning? I've heard people say it's good for digestion.
Lemon is acidic, so it may worsen reflux for some. If you want, try a small amount in warm water and see how your body reacts. Everyone is different.
Got it. Any home remedies that really help?
Ginger is excellent. It soothes the stomach. Aloe vera juice can calm the esophagus. Some people use a pinch of baking soda and water occasionally, but don't overdo it. Eating bananas or papaya also helps neutralize acid.
That's great. How about lifestyle changes?
Very important. Maintaining a healthy weight reduces pressure on your stomach. Avoid tight clothing around the waist after meals. Manage stress through meditation or deep breathing. And don't forget good sleep habits. Elevate your head slightly and avoid lying down immediately after eating.
What about exercise? I've heard working out can sometimes trigger acidity.
It depends on the type of exercise. Light walks after meals are perfect. Avoid vigorous exercises right after eating. Yoga can be beneficial for digestion, especially poses that gently stretch the abdomen without putting too much pressure.
Yoga is good for everything. What about over-the-counter medications?
Antacids provide temporary relief, but they don't fix the root cause. H2 blockers or proton pump inhibitors are options for persistent acidity, but always consult a doctor before regular use. Lifestyle changes are the long-term solution.
Makes sense. What about eating habits? Anything people commonly ignore?
People often eat too fast. Chew properly. Avoid lying down or sleeping immediately after eating. Eating smaller, balanced meals multiple times a day instead of 1 or 2 heavy meals is much better. Also, spicy and oily snacks late at night are a big no.
I guess posture matters too, right?
Absolutely. Slouching after meals increases acid reflux. Stand or sit upright. Smoking worsens acidity, so reducing or quitting smoking helps. Avoid tight belts or waistbands.
Any tips for nighttime acidity? I sometimes wake up burning.
Elevate your head while sleeping, ideally with an extra pillow. Avoid heavy dinners right before bed. Try not to eat within 2 to 3 hours of sleep. Also, sleep on your left side. It keeps the acid in the stomach.
That's interesting. I didn't know side sleeping mattered.
Yes, it does. Also, keeping a food diary helps. Track what you eat and how your stomach reacts. Over time, you'll know which foods trigger your acidity.
That's smart. So basically, managing acidity is about diet, habits, stress, posture, and mindful living.
Exactly. Combined all these and acidity becomes manageable. Listen to your body. Persistent or severe symptoms always need medical attention.
Thanks, Emma. These types are really practical. I feel confident I can manage my acidity now.
Happy to help. To our listeners, small changes in your meals, lifestyle, and habits can make a huge difference. Try these tips consistently.
Yes, eat smart, manage stress, stay upright, and track your triggers. You'll feel much better.
That's it for today's episode. Stay healthy, be mindful, and take care of your stomach. See you next time.
Bye, everyone.